At Zental, we do a lot of dental implants, and they come in two different types. You can either have single implants or multiple implants. The main difference between the pair of them is that single implants are essentially a replacement for single tooth. And what it consists of is a small titanium post that replaces the root portion of your tooth, and that allows us to put a custom-made tooth on top of that to mimic the tooth portion which you've got missing. So multiple implants are essentially the same thing, but on a grander scale, depending on the size of the gap. So we place strategically implants in to give you either numerous single teeth, a dental implant bridge, or sometimes even full mouth. So it really depends on your situation, what you need, but we offer everything. When we do dental implants, we tend to follow up with our patients quite often, and the feedback they tend to give us is that straight away from the get-go, that dental implants feel and look quite natural. So the moment they step out, they're able to eat, they're able to show off their really nice smile, and patients always say that they're very happy with the effort we've gone through to make it look like we mimic their other teeth in their mouth. From a health point of view, as a clinician, the beauty about dental implants is that we don't end up damaging neighbouring teeth. So if we met 20 years ago, the only way to replace teeth and give you something fixed and fixed into your mouth would be to shave 2 teeth down. But with dental implants, we don't need to do that. So we save your natural teeth, and if anything, we only support them by keeping implants in to take the pressure off them as well. So dental implants, along with that, will help preserve your bone structure. So you may realise some people say when you take teeth out, your bone starts to shrink, your face starts stiffening. So dental implants will actually signal to your bone that there's teeth still there, and to maintain that bone as well. So patients are generally quite happy with the cosmetic side of things, the feel, and obviously the main one is the chewing. So they're able to chew all foods again. The amount of food that patients can eat, there's so many things back on the menu now for them. So these are just some of the benefits that dental implants can provide, and we can definitely help with that as Zental. Normally at Zental, how it would work is you come in for a consultation, and the point of the consultation is for me to get to know you, you to get to know me, and we want to really get to know what your problems are and find out a way we can really help tailor-make this service for you. We will check your oral health, we'll check that your bone, your gums, everything is healthy enough to have dental implants, and we'll outline a treatment plan for you. If you're obviously at the time not suitable for dental implants, we'll make sure you have a plan of action to get suitable, and then you can have dental implants as well. So once we have the treatment plan, everything will be written out for you, so everything makes sense. This is an opportunity for you to ask us questions. If anything doesn't make sense, you're never rushed. You've got a moment to take it away and ask us again if there is anything on your mind. And then really it's about getting your books back in for the main surgery date, and that's where we put the dental implant, which is the titanium post, back into your jawbone. And once that's done, we normally leave it for around 8 to 12 weeks, depending on the case. And that's a process called osseointegration, where your bone will start accepting the dental implant. And after that period of time, you come back and we will make you a final set of teeth, tooth, depending on what you are having. And then once that's fitted, you obviously go away, start enjoying that tooth, and we'll just follow up and maintain that. So our promise to you is not just that we're going to give you a dental implant, but we'll give you a dental implant that will be lasting for the long term. So the results of dental implants are phenomenal. Straight away you'll come in, once your teeth are fitted in, you can walk out. You don't need to wait an hour or 2 hours to eat. You can eat straight away, put the teeth to good use, and when you're smiling and laughing, you're out with your friends and family, you'll be able to see that these teeth that we've custom made for you will really match and mimic the rest of your teeth. The shape, the colour, everything will look very natural and blend in really nicely. So a lot of care does go into these dental implants, and I'm sure you'll be extremely pleased. So the big misconception is that dental implants are just a replacement for teeth. They actually give you fixed teeth, correct, but they actually give you so much more confidence to now go back out there, meet up with friends and family, give speeches, talk, not have to worry that my teeth are going to, number one, break, I've got any loose teeth that are just going to fall out, or I've got dentures which are slipping and sliding around inside. So you've got the confidence to order whatever you want from the menu, If you're laughing and speaking and around loved ones, you're not self-conscious of how your teeth look. And I think from a primal point of view, you just feel a lot more natural yourself. So I think that's priceless. And this patient came to see me really nervous, really anxious, because she was so embarrassed about the state of her teeth. She's had gum disease for the past 20 years. She's been smoking for probably her whole adult life, if anything. And she's not been given any solutions for her gum disease. So she's really kind of in a little rut, doesn't know what to do about them, doesn't know how to save her teeth, doesn't know if the teeth need to come out, what to do with them. And she really just wants a nice fixed set of teeth that she's not going to worry that are going to wobble out, and something that actually just looks half decent. So obviously we saw her for a consultation, we addressed her needs and wants, we really got down to the crux of why she's so anxious, what these teeth, the wobbling, the appearance of them, what that means for her. And we came down and found a solution, which was dental implants with a fixed bridge. So what we did is we provided her with some sedation, we placed 4 dental implants, and we gave her a set of teeth straight away. And she was literally over the moon. So as you can see from the photos, she's walking now out and about, literally different woman. It's taken literally 10-20 years off her, and she's able to eat again everything back on the menu, and she's always literally coming in for her follow-ups in a completely different state of mind.